Jesus bless. We are here to talk and do our makeup. We're going downtown, so yeah. The red carpet for YouTube, whatever that is, I hope it's going okay. So all right, for primer I'm going in with, so we bathed already, face is washed. I use Merit cleanser and Pharmacy's Green Clean on my face, neck, chest, legs, in between. And then I use True Blue Spa exfoliating body, and True Blue Spa is from Bath and Body Works. And I also used the Cocoa Shea from Bath and Body Works on my body. So anyways, the stuff to talk about. Listen. I spoke about, this is Ulta's lip pencil that came in the advent calendar, celebrating the season of Jesus's birth, Christmas time. Pets. People would bring animals, and you know, for whatever reason, they're sick, it's a regular checkup for wellness. They want to be sure they're like prepared to catch something before it starts, like a pre-check. You know, because God forbid there's people who are pre-diabetic and stuff like that. You know what I mean? We rebuke illness in the mighty name of Jesus. And it's not to sound like it's a joke, it's serious. This is Huda Beauty's Baby Pink. I showed you this lip stain before. Just lining my lips. Kind of like Jessie Hartel with her chronological order, how she would do her lips. Mainly before she does anything else, like before she does her full face of makeup. So yeah, they, like, if you think about it, the Bible tells us to beware of dogs, you know, how you do certain things, and they give them things that are sacred, God forbid, and they turn and eat their vomit and trample these things, like the pigs as well. And I was thinking about it, and I'm like, you know, people bring pets, the animal is overweight, it is like suffering because its joints are going through it. If you think about a cat, that is, and I've mentioned this before, they're agile creatures. They climb, jump. If they jump off of, they climb trees. If they jump off of a building or a wall or whatever, for adventure, for hunting, for fun, for whatever, escape, whatever the fuck, they like to catch birds, squirrels, whatever, they rats, they, and thank you Jesus, they don't really get leptospirosis because there's adaptation by the grace of Jesus. Okay, it's not a joke. And it's also not a joke, so like I'm doing my eyebrows because you have to look on, you look on them people. Imagine all the fat around the cat's heart. Their lungs, they need space for those organs. Their joints, their legs, they have all this weight on weighing them down. And people just an animal with heart disease. How do you think you're going to be taking it? Like, think if the heart is responsible for pumping, delivering oxygen, removing waste. If you think about inspiration, expiration, if you have an animal with a heart defect, they shouldn't be under stress. You shouldn't be scaring them. You shouldn't be dragging them down the street because you want to go to happy hour and you want to show off. You want to, I have pets and you don't. I have this leash and you go sit the fuck down. Take the animal to the, pray to Jesus first. Take the animal to the vet. And the person who is in charge of there, by the grace of Jesus, who appointed these people to help people like me and people like other people with their vet degree to help you and listen, so that the animal don't keel over out a road and have you looking like a fucking idiot. I've had clients like that. Skin disease. Thank God we rebuked that before we started, because I'm here doing makeup and whatever, and we're talking about allergies. That's a form of a skin pathology. Why do you think, you spend your money going to the vet, you get medical advice, the medication, the diet, different stuff, and then all you think you're gonna do is not listen, or only do it because if you have allergies, unless you pray to Jesus and ask him to, which he's good to help heal the animal so they don't have to keep going through whatever illness or whatever. They're gonna have allergies until they die. We go to school, we don't make shit up. So here it is, you come with the animal, you only do the medication for 3 days, and then you think the animal is just gonna be healed forever. And then when the allergy comes back, you vex and you want to call whoever and try to sue. You look so stupid. You lose in court. This is what they talk about when they say in the Bible, do not be hasty to bring people to court. Aggression. If you have an animal, this one annoys me. You have an animal and it's clear as day to the people on the street, to the people in the home, that this animal, God forbid, is attacking. You take it to the behaviorist, you take it to the vet. Vets are behaviorists as well. They tell you what to do. They tell you, give this medication, do these things around the house, enrichment, training, and you sit down there with the animal. Some of you get the animal because you want it to be that way. Wicked wrath, I rebuke in the name of Jesus. Where do you think you're gonna go? And then there's people, them purpose. They know the animal is like that. They want the animal to be that way. And then on top of it, they're bringing it to people, bringing it around people to test them, to people who would request specific doctors on their case because they want the puss or the dog to bite them, or to and then, or to bite the owner or whoever, and then so they can come up with a lawsuit. Sit the fuck down. The animal needs to be taken from you. Wicked ass. I don't like that. Why do you want... And some of these animals, they're wearing clothes. The people put them in clothes so you can tell that the animal can be reasonable. I've told you before, if you observe Jesus's creatures that he put here, you see they're not stupid. They have a system. If for whatever reason them get where, some of them love run and come off the leash or whatever. This is why they have rules. Some people, they're coming in, they want this vet, they want that vet. I understand if you want to stay with the same person because you feel like it's gonna be continuous medical record. Regardless, each time a patient comes in, you're to do a whole new assessment. Look at the history. However, you still need to look at what is currently happening and think about what you want, what could happen in the future, what you may need to avoid. Someone don't want the surgeon to fuck up. Stupid ass. I remember one time the person, I don't know if I told this story, this one. The person had, silly. You get you pay thousands of dollars. Somehow, the people tell you do not have the dog running wild. Somehow know the knee a click from birth. And then I have the animal running, jumping, until, God forbid, they sprain something, they break something, they have a fracture. Now their arthritis a kick. And then what do? You get them to get a replacement surgery for their hip and their knees and then blood clot, and then, or cut you off, and then you carry them right to the park. Stupid ass. You're gonna be fucked up. And then, listen. Huda Beauty setting powder. It's so pretty. I'm gonna set underneath my eyes. Let's use the same brush that we use for the concealer. I remember I had a patient and it had a broken leg. How did we find out it was broken? We took an x-ray. There's a team. Sometimes the vet, by the grace of Jesus, can do, all the diagnostics and the exam and everything. the educating the clients, the treatments, putting the IV, pull the joint fluid, do the abdominocentesis, whatever the fuck they have to do. You know, sometimes typically to be more efficient, you would want a team. So, you know, the dog is limping, it's overweight. Even though it's fluffy, I can tell. And then you do a physical exam. When you touch the animal, you know, you touch their sides along the top, you feel by, you know, their waist, the abdominal tuck, you can tell their body condition score. So this animal was like a 7 out of 9, 8 out of 9. It was, let's say, a 7 to 8. Let's give him a 7. I don't have my records with me right now. This was like a while, you know, like last year maybe, or this, what, wait, no, last year or late the year before. It doesn't matter. So point of the matter is he's limping, and you know, you talk to the owner is telling me, based on the history, that this animal was limping for about a week, and they know because I think they left him with somebody and they came back, and then they saw him limping. 7% on the Osmo. We have to hurry because we gotta go. Anyway, so we do the x-ray, I see the fracture, I tell them, you know, this is something we can put a bandage on it, because, you know, you don't necessarily want to be invasive right away with surgery and, you know, putting pins and plates and shit, because some of those things can reject, and, you know, whatever, it wasn't indicated in that case. So we do the bandage and send the dog home. I tell the lady, you're gonna have to ideally come back, and I repeated it, and I think we even wrote it down, or give her this, we scheduled her ahead of time for her appointments to let her know she's gonna come in. You know, we're gonna we're gonna re-bandage it, we're gonna re-image it, because we want to see if the fracture is healing. And don't be mistaken, I don't know if I've said this before, things heal by the grace of Jesus. You want them to heal in the best way by the grace of Jesus. So if there's a fracture, ideally you want to oppose the layers so that they're in line. So, you know, jaggy when it's a fix and the scar tissue is filling in. If we're gonna talk about the osteosomes and the little blast, whatever the fucking cells are, I'm not gonna go in my bio book right now. Like, listen. The point of the matter is there's cells that form bone. Okay, so anyways, we check it back, and this, you know, sorry, well, we talk before she comes in, I tell her she's gonna have to come in again after that to keep changing the bandage. And then at some point, in like another couple weeks, you know, cause first she's gonna come back, whatever, we're gonna have to re-image again to see what's going on. Bone and nerve take time to heal. I'm telling about nerves already. This is probably the first time we're talking about osteoblasts and osteoclasts. That's the name of the fucking cells. Go to vet school if you want to learn the rest. If you don't want me to teach, you know, I don't know if I can necessary. I don't know if that's necessary. If Jesus want me to do that, I gladly will. So, anyways, this let me do this. This is the shade. We're not doing the lighter one because I'm doing a little bronzer. So the dog comes back. They didn't tell me the dog was back right away, okay? And I mean, if I have other patients, if I was doing something, I get that. Sometimes if it's a recheck, some people think it's a bumbleclot joke and a rush thing. I mean, I like that. They want to get people in and out, and I understand that. However, if you had a fracture, if you know, if it's something you took an x-ray, you think the doctor needs to see it, right? So I see the dog and I remember my patients. I remember their names, you know, by the grace of Jesus. Not all of them. However, like, especially at the time, I remember. So I see it and I'm like, why is the bandage still on, first of all? Because they took an x-ray, and I think that is what they called me. They're calling me to they probably didn't even call me for this because I saw the animal. So the animal's bandage, first of all, I see him and he's fatter than when he came in. And then his bandage is wet. And then I look and I see they took an x-ray with the bandage still on. So annoyed. I was like, okay, let's take the bandage off. If you have a fracture and you're trying to image it, you don't need obstructions in the way. Ideally, you want to visualize it. We have 3% on the Osmo. You know, so when we take the x-ray, lo and behold, you know, funny, the fracture is worse. Like it's even more, what's the word I use for it again? Displaced than when it first. So I go to the owner and I'm like, I think I asked him to put the owner in, you know, and so I could talk to them. And I'm like, you know, getting there telling me, oh, the dog felt so much better. It was running around and jumping. And I'm looking at them and I'm remembering telling them when they came, first off, he needs to lose weight because he's going to stress his joints, especially with a fracture. He's developing arthritis based on Jesus's design of life and society and universe, regardless. So why is he fatter? Why have you been having him? I told him he needs to be on exercise, cage rest, exercise restriction. Meaning he shouldn't be running on a broken leg. Come on, use common sense, people. If you please, I hope you have it. We've asked for Jesus to give it to us the last time. You know, have him on a leash for a short, you know, and it's not forever. It's until the fracture heals. I had a racing dog in rehab and fostering because, you know, they took him from that environment situation. And the doctor let me know. I wasn't a doctor at the time. She's a really cool vet. The whole team, they're very smart and talented. Jesus bless. They let me know, you know, this is what we have to do. He needs to be in the crate. He can't be running around. He goes on short walks because you don't want him to be in pain and you want him to heal up appropriately. That no mean you gotta have him sit down in the cage and piss up himself and shit up himself. No way. This nigga had situation going on where him something did from the way how I got him. He was very lean and his shit was crooked. So when him piss, it would have catch on him foot. And I would have to wipe it down. And at the same time, I don't want to do too much. And then he's probably offloading on one foot or whatever. And then, bruh. You know, so I spoke to the clients and they were understanding, it seemed. And we had to change the bandage because you don't want it to grow juju. Wrapped up, tied up, tangled. Why? And this is, you know, so communication is very important. And for people to try to tell me I'm catatonic and stupid shit, like it's annoying because Jesus gave me a role where I communicate and I know when to shut the fuck up. Vet school taught me if you don't know, don't act like it and don't say the wrong thing. Don't try to guess. It was literally on one of my stuff. Don't try to guess. Not that I was out there doing that. That was early on actually. That was like my third rotation. And the cardiologist was, you know, telling us that, because that's also very important. Don't come smiling in my face telling me how you had the dog walking for 30 minutes and it has heart disease when I told you what the fuck was